Hello everybody. I'm Dr. Mazda, lecturer of internal medicine and instructor in the preparation of MRCP courses from Faculty of Medicine, University of Khartoum. This video is going to be about some demonstrations and some of the samples of the MRCP preparation course. And this, as I said in the advertisement, that this course will be highly concentrated. It is a core course. It's clinically oriented. There is some summaries, PDF summaries, and also we have videos and also recordings. This short video will be about some of the major topics which are usually covered currently in the courses, and also in the questions in the as major question in the exam. This case scenario will be as an entrance for the what will be said and discussed about it. It is a combination between infectious diseases and also CNS diseases. So let us start about this case scenario. Okay, we have a 40-year-old man recently arrived to London from Sudan. Came to the emergency department with fever, confusion, and also headache. Now, what is the next step in the management of the patient? As I said also, the most important next step, what is next step to be done for the patient in the case scenario? One of the major questions, as you know, in many samples in the MRCP exam. So we have now, is it LV or Headche scan, ceftriaxone, vancomycin, ceftriaxone, quinine, and acyclovir, or a movement of the patient to the ICU. Before we can choose the most appropriate answer, we should discuss this case scenario vigorously. When a patient is admitted to the casualty with fever, confusion, and headache, I should put a differential diagnosis in my mind. So what can this patient complain of as his age, where does he come from? Also, we should put in our mind that the other associated symptoms of the patient, the GI manifestations, is it present? Also, is any some sort of skin manifestations in the case scenario? Is there an endemic place common to have a major epidemic and endemic diseases he is coming from? We have to put all this in our mind actually. So then the patient is actually complaining of fever, confusion, and headache. We know that any patient have fever plus headache. Okay. This has a list of differential diagnosis as an infectious cause. Okay, for example, any patient complain of fever, any complain of meningitis. This patient also can complain of encephalitis. We should also not forget about the brain abscess as fever and headache also. This patient also can complain of maybe toxoplasmosis if he is coming from an area endemic with toxoplasmosis, for example, and so on. All of this is differential diagnosis. But there is another keyword, can know our list of differential or put another differential diagnosis, which this patient is complaining of fever, confusion, and also headache. So we have fever, headache, plus confusion. So our keyword in this case is, rather than fever and headache, is confusion. You should put in your mind that any patient admitted to the casualty with fever, headache, and also confusion, that's to say there's some sort of alteration of the mental state of the patient, you should raise in your mind and put a list of very appropriate differential diagnoses like those. This patient can complain of meningitis and also could complain of encephalitis, and also we can add another list for this complaint. This patient is also can complain of cerebral malaria. Cerebral malaria is a very known infectious cause of fever, headache, and also confusion, alteration of the mental status, which can lead to coma later on if the patient not treated vigorously. Those patients also can complain whether this patient is coming from Africa, is coming from Sudan. So it is a known endemic place of multiple infectious diseases such as malaria, also such as viral hemorrhagic fevers also. So this patient also can complain of viral hemorrhagic fevers, especially Ebola and dengue fever. They are present actually in Sudan, especially in the last 3 to 4 years. So this patient also can complain of one of the viral hemorrhagic fever, such as Ebola and also dengue fever. Okay, so now our patient is a 40-year-old man. He actually is not an immunocompromised patient, okay? He's not an HIV patient. So the general causes of meningitis could be now excluded. For example, Listeria monocytogenes and Streptococcus meningitis, which are the causes of meningitis in immunocompromised patient. This is an immunocompetent individual coming from a country known to be having a multiple comorbidities such as infectious diseases, malaria, viral hemorrhagic fevers, leishmania, and so on and so on. Okay? So he has fever, confusion, and also headache. So our keyword now is that we have confusion. This patient complains of confusion and neurological manifestations. Okay, we want to know what's the most important next step in the management of this patient. I don't know which disease is actually the cause without any investigations. I have no investigations here in this case. There is no CBC, okay? There is no hemoglobin level. There is no CT scan. There is no lumbar puncture. There is nothing can lead you to the straight diagnosis and straight appropriate diagnosis in this case. So I have to know what the most important next step. Is it to stabilize the patient? Is it to reach a diagnosis? Is it to treat the patient? What can I do actually? You should know that these complaints, these symptoms, with this list of differential diagnosis, meningitis, and encephalitis, especially viral encephalitis. When I say meningitis, I mean bacterial meningitis because it has an obvious clinical manifestations. Many times the viral meningitis could have a very mild symptoms in comparison to the bacterial meningitis. So this is most probably this bacterial meningitis, and this is a viral actual encephalitis or actual cerebral malaria. And also we have a differential diagnosis as a viral hemorrhagic fever. Okay, all of those are severe diseases associated with a very high rate of mortality and morbidity. Okay, so the most important next step in the management of this patient is to prevent the complications. Okay, to stabilize the patient. And according to this, actually, I should rush to the answer which is associated with my understanding for the case and differential diagnosis. That's to say that this patient next step should be stabilized, and this patient should be prevented with the major complications associated with those diseases. Okay, meningitis is a killing disease, viral encephalitis is a killing disease, cerebral malaria is a killing disease if not treated. Okay, and also the viral hemorrhagic fevers. All of those diseases have specific treatment. Okay, and specific empiric treatment and empiric therapy. Even you are not comparing meningitis, encephalitis, or cerebral malaria. Viral hemorrhagic fevers have no specific treatment. It has just some sort of supportive medications. So, regarding the list of my differential diagnosis, okay, the most important next step in this patient is to stabilize and to prevent the complications. Okay, now the diagnosis is not that clear, but I know from my clinical sense, from my clinical suspicion, is that the complaint of the patient is one of those diseases most likely. No other differential diagnosis go with the case scenario rather than those. So I have to start with the empiric therapy, which lead to stabilize of the patient, and also which will gonna prevent the complications. Okay, the empiric therapy of meningitis, of bacterial meningitis, is known to be IV ceftriaxone, and any patient complaining of cerebral malaria, you have to give him empirically IV quinine. You should know that the empiric therapy of malaria is different from that of the prophylaxis. The prophylaxis, the drugs such as mifequine, is not that empiric drugs such as quinine or quinine. And also the empiric treatment and the specific treatment for encephalitis is the acyclovir. So IV acyclovir. So all of those should be given to the patient, waiting for the results of the investigations. Okay. So the most appropriate therapy for this patient is that I should give the patient yes, the cetirizine, quinine, and also acyclovir. Both of those should be given intravenously. Lumbar puncture is not the next step. Lumbar puncture could be one after that to exclude bacterial meningitis, and it will differentiate it from viral meningitis as well. Head CT scan also is not the next important. Head CT scan is important in the cases of meningitis and encephalitis to know the extent of the edema and to know if there is some sort of another associated specific lesion and exclusion of toxoplasmosis and brain abscess and other specific lesion. Okay. Moving with the patient to the ICU if he is a critically ill patient. Okay. After doing stabilization of the patient and the patient is continue worsening, I can admit him to the ICU. But the most appropriate next step in this patient is to treat the patient empirically. Now you are sure that the patient is safe, and you will going to prevent the complications, especially from meningitis and from encephalitis. Now, another question should raise in our mind that what other things, if they were in the case, can raise a very high suspicion of meningitis, for example. If in this case, if the patient actually is complaining, also if he has some sort of photosensitivity or like hypersensitivity, such as photophobia, so most probably this will raise up the suspicion of meningitis, and I could give him just cetirizine as an empiric therapy. And also if he has photophobia and some sort of neck stiffness. So if this patient is also complaining of fever, headache, photophobia, and neck stiffness, this will raise the suspicion of meningitis, and I could give him the just the empiric treatment of meningitis, cetirizine, waiting for the results of blood cultures or the lumbar puncture. If he is complaining of meningitis, the most important next step after doing the cetirizine, the patient should have lumbar puncture to know which type of meningitis. Most probably he will complain of bacterial meningitis. And we know in this area we should differentiate between bacterial and viral meningitis. Okay, so that in lumbar puncture I'm searching about the level of the protein in the cerebrospinal fluid, and also I'm searching about the level of the cells, meaning here the neutrophils and lymphocytes, and also I should search about the level of the glucose. Okay, if the patient has a very high protein, this is highly suspicious of bacterial meningitis, but it's not that specific. It is suspicious but not specific for bacterial meningitis. Okay, the level of the protein is also increasing in viral, but it's more and more increasing in bacterial meningitis. The level of the cells, if I have neutrophilia in high neutrophil count in the CSF, this will raise a suspicion of bacterial meningitis. If we have lymphocytes, this will raise a suspicion of lymphocytic viral meningitis, or if the patient has a chronic illness such as chronic cough, and this can raise the suspicion of tuberculous meningitis, especially if the patient immunosuppressed or immunocompromised. If the patient has a low glucose level, this will raise the bacterial meningitis, because we know that many of the bacteria are fermentated for glucose, such as Neisseria meningitis and also strep pneumoniae. So the fermentated process of glucose will lead to a low glucose in the cerebrospinal fluid. But in the viral meningitis, usually there is usually a normal level of glucose in the cerebrospinal fluid. Okay, regarding protein, the protein level will be just a mild elevated, not very much elevated. Cells will be lymphocytic cells as well. Okay, so this is how to differentiate between viral meningitis and viral encephalitis, as well as viral encephalitis. Okay, now, so this is about lumbar puncture. We have to know that lumbar puncture is not the most important specific investigation for bacterial meningitis. The most important investigation for bacterial meningitis is culture. Okay, whether it is CSF culture or blood culture. Okay, this is the most important specific investigation for bacterial meningitis. Okay. Now, so this is if the patient has photophobia and neck stiffness. I have doing LV and also the most important investigation, which is the culture, whether for the cerebrospinal fluid or whether this culture is going to be for the blood if the patient having fever and hypertension and signs of sepsis. Now, we should discuss another differential diagnosis also for this case scenario, which could be the subarachnoid hemorrhage. Now, if this patient have an abrupt onset of very severe headache, he has an abrupt onset of a very severe headache, okay, plus also he can have some sort of neck stiffness and mild photophobia, okay, but the sudden and abrupt onset of headache, that's to say headache in just 1 hour or just in minutes, rising headache quickly, and it's very severe headache with just maybe a mild fever, not a very high grade fever, this can raise the high suspicion of subarachnoid hemorrhage. So in those patients with a high suspicion of subarachnoid hemorrhage from the case scenario, now the most important next step for those patients should be the CT scan, brain CT scan, and this CT scan should be CT scan with non-contrast, a non-contrast CT scan, okay? According to the CT scan, you should, I can diagnose the subarachnoid hemorrhage and differentiate it between the other causes of brain hemorrhage, the intracranial hemorrhage, the subdural hematoma, and also the extradural hematoma. Okay, so this is the most important next step if the patient has a very high suspicion of subarachnoid hemorrhage. Okay, now if, as in this case, this is the high suspicion of malaria, which is cerebral malaria, could be confirmed by if the patient has fever, confusion, plus if the patient later on complaining of coma. The patient went in a deep coma, this will raise a very high suspicion of malaria, so the patient now will have some sort of malaria, okay, and this patient should be given IV quinine. And after giving IV quinine, I should rush to the investigations of malaria, the thick blood film. So blood film for malaria, okay, or even ICT for malaria to confirm the diagnosis of cerebral malaria, and also in whether if it is malaria or subarachnoid hemorrhage or even meningitis, I should do CT scan for the patient. Why? To exclude any complications such as brain edema, okay, or any suspected which can lead to herniation process, and the patient also can die from herniation and conization of the brain through the foramen magnum. Okay, now, so this is if the patient is complaining of cerebral malaria. These are the most important investigation, and the next step for all the cases is to stabilize the patient to prevent the complications. Okay, now. So in this case, if I am going to confirm that the patient has meningitis, what can be added for the patient in addition to IV ceftriaxone? Okay, in cases of meningitis and also in case of encephalitis, I should add IV steroids such as dexamethasone. So the answer could be IV ceftriaxone plus IV dexamethasone. And IV dexamethasone is to suppress the inflammation and to suppress the edema, and so to prevent the complications such as the massive edema and herniation of the brain. Okay, and this is one of the most common causes of death in patients complaining of cerebral edema, whether due to cerebral malaria and whether due to meningitis. This cerebral edema can cause displacement of the brain and herniation of the brain through the foramen magnum, so that the brain stem is compressed and the patient can die suddenly, okay, due to this process from the compression of the the cardiorespiratory center in the brain stem. Okay, so this is about how to analyze the case, the patient, how to analyze the case, whether it is meningitis, whether it is subarachnoid hemorrhage, whether the patient is complaining of encephalitis, and whether the patient is complaining of cerebral edema, and what's important next step according to some keywords are being demonstrated in the case. So this is how, briefly, how to deal with some MCQs, how to deal with such case scenarios. One word in the question can make a huge difference, okay? Confusion is associated usually with encephalitis, altered mental status, okay? Coma is usually associated with cerebral malaria plus given a history of endemic place such as Sudan. Okay, this patient is coming from Sudan, so this our case. This case most probably it is. I said without specific investigations, I cannot conclude that this is malaria or meningitis. But a patient this patient coming from Sudan and has a history of confusion, okay, can raise the suspicion of cerebral malaria. So confusion and deep coma and history of endemicity is common with cerebral malaria. Okay, photophobia, neck stiffness. Photophobia and neck stiffness can raise with a high grade fever can raise the suspicion of bacterial meningitis, okay, and so on. So you should remember that one word can make a difference, okay. One word can change your decision about the next step, okay. You should know that the most important investigations for everyone for meningitis is the most specific investigation is blood and also CSF culture, okay. If it's not found, you should go to the microscopy for the cerebrospinal fluid to know which organism we are dealing with. Is it gram-positive cocci or gram-negative bacilli or gram-positive rots? Which organisms we are dealing with? If you have viral encephalitis, you should rush to the cerebrospinal fluid and do PCR for the cerebrospinal fluid. This is the most important investigation for viral encephalitis associated with the altered mental status of the patient. If the patient complains of cerebral malaria, you should go after you doing CT scan for the patient, non-contrast, which is the same investigation for patients complaining with subarachnoid hemorrhage. After exclusion of brain edema, you should rush to the thick and the thin blood film and also the RCT for malaria to confirm the diagnosis. Okay? So thank you. This is our first sample video. In next videos, we will demonstrate our case scenarios and know how the keywords and how one word can make a difference, and according to it, how we can deal with the case and choose the most appropriate answer in the question. Thank you.